Shoulder pain in the gym can range from nagging injuries all the way up to emergency status and fast. And sometimes it's hard to know the difference between the two. My name is Dr. Tomlinson. I'm a board certified doctor of physical therapy. And today I'm going to share with you my 4-step assessment process that you can do at home that's going to tell you if you need to get your shoulder checked out by a doctor. So the first thing that we need to do is get a baseline assessment of your shoulder. And that's what we're going to do in steps 1 and 2. In steps 3 and 4, we're digging a little deeper and figuring out what's going on with the shoulder based off of what we find in 1 and 2. And then we're tying it in with some specific pathology tests to determine what exactly is going on with your shoulder. And so let's jump right in with step number 1, the Apley scratch test. Here's what you're going to do. You're going to get your right hand and reach over your shoulder and try and touch your left hand behind your back. Note of how close your hands get. And then you're going to do the same thing with the left hand over the shoulder and try and touch the right hand behind the back. What we're looking for is how close your hands can get. Can your fingers touch, or are you a lot further apart? Also, is it painful? Does one side feel tighter than the other? Make note of that. If this is not painful, then congratulations. You probably didn't click on this video because you have shoulder pain. And so something's going to hurt whenever you do this. And that means we got to dig a little deeper. So something hurt, we dig a little deeper, and we go to the Apley breakdown. And now we're going to split this into the parts. You're going to take your right hand and you're going to reach over your right shoulder. And I want you to tap your back with your middle finger and make note of where that's at. Do the same thing with the left side. Tap your back with the middle finger and note where it's at in relation to where you just tapped with the right. Is it higher? Is it lower? Is it painful on this side? Then you're going to put the hand behind the back for the right side and tap with the middle finger there. And then on the left, tap with the middle finger on that side. Once again, is it painful? Is it tighter? Can you go further on one side or the other? And make note of that. You're going to have pain with this because it was painful on the original test. We have our baseline assessment. Now we can start to get in the weeds a little bit and see exactly what's going on. You're going to lay on your stomach. Try and tap your back with your right hand. Note, is it a lot harder? Is it painful now? Is it not painful now? You're going to do it on the left side as well, both over the shoulder and behind the back. And we're looking for any changes for better or worse. Let's say your pain got better with this. You most likely have some kind of postural component going on. When you lay on your stomach, it takes out that rounded back, straightens you out, and the shoulder's able to move a little bit better. You probably need to work on some more postural stuff. But let's say you do still have pain with this, or that you just can't get into that position. It makes it a lot harder. We got to do a little bit more digging. We're going to finish up with our shoulder flexion test. You're going to lay on your back and you're going to just bring your hand up over your head to that full range of motion. You can give a little overpressure on it as well. And once again, we're just looking, can you get that arm flat on the bench? Is it the same on one side or the other? Does this cause that pain? If it does, then you're most likely dealing with some shoulder range of motion issues, maybe some tightness in some muscles, and maybe the lats that are giving you issues there. Now, let's say you get down to the end of it and that hurts your shoulder and you want to know what's going on with it. So we're going to do some special tests to figure out exactly what's going on. So we're going to do an impingement test, which is where you're taking, let's say the painful side is the right side. You're going to reach across, tap the left shoulder, and you're going to bring your elbow up towards the ceiling slowly. If this increases or reproduces your pain, then you're most likely dealing with some kind of rotator cuff issue that's getting impinged in your shoulder. Now, once again, that can be caused by any number of these things. And then we do the same thing for the AC joint. You're going to bring that arm across your body and give a little overpressure. If you have pain on the front with this test, then you most likely have something going on with that AC joint there. When should you get your shoulder checked out by a doctor? Well, I would say if you value the health of your rotator cuff and if you value the health of the single attachment that your shoulder has to your body, then I would absolutely go get your shoulder checked out if you had pain with any of these tests. You only got one body. We need to take care of it. That's it for today.